Hey everybody, Martin here with Tree of Light Health. Would love to talk to you guys about a very important problem that we've been dealing with for many years in our practice, and hopefully this will help you in your healing journey. So today I'd like to talk about mold and mycotoxins, in particular certain biotoxins. This is a really important thing, especially if you have been suffering from something for a long time and have not gotten to the root cause. For those of you that have been suffering with mold and biotoxin illness, there are some clinical pearls here. This video is really designed for new patients and existing patients. Practitioners, you may get some information here, but probably best to seek out some of the sources that we'll list here. But anyway, there's something here for everybody. Anyhow, quick medical disclaimer. This information here is just for educational purposes only and not to be used for any medical assessment or diagnostic treatment. Just want to acknowledge some of the great doctors that I've learned from and trained with over the years, in particular, Dr. Andrew Campbell, who is a medical doctor and has given us a lot of great advice, at least in the past 3 or 4 years. We can't go further without mentioning Dr. Ricky Shoemaker. I'm sure some of you have heard of him. Anyway, he came up with or at least brought to our awareness this condition called chronic inflammatory response syndrome, which we'll get into. Dr. Neil Nathan, of course, who is another medical doctor who has done wonderful work in the mold and biotoxin arena. And we've learned a lot from him. This book here, Toxic, I would recommend you read. And then Dr. Jill Krista, who we have trained with, at least on the naturopathic side, and also wonderful information that she can deliver. And in fact, wrote a book called Break the Mold, which I highly suggest you read. So from the World Health Organization, mold and mycotoxins is known as the great masquerader of the 21st century because of its many complex natural history involving the different tissues and diseases in each of its disease states. So that's pretty powerful coming from the World Health Organization. If you've been dealing with a chronic condition and you have not yet gotten to the root cause, I would strongly recommend that you look at mold and biotoxin illness. Especially here in the Southeast, we've had lots of rain, and they say that April showers bring May flowers. However, the rain keeps coming, and in May, of course, if you're in the Southeast, especially in the Atlanta area, and the rain just keeps coming all summer long, sometimes we have a little bit of a heat wave. But anyway, when to suspect that this might be a problem for you? Well, if you've had a previous exposure to mold and water damaged buildings, okay, and even if that's been years ago, we'll talk about mold colonization a little bit and how molds can actually grow in your system, despite the fact that you're not currently in a moldy building. If you, of course, observe a visible or musty odor, now remember that molds and mycotoxins often do not contain or at least have a smell. Okay, so even though you don't smell this, the common misconception is, oh, I don't smell mold in my house or my home or my office, therefore I don't have a problem. That's not true. We do find mold and mycotoxins in situations where there's no odor present. So if you're dealing with any mystery chronic illness, okay, so that means brain fog, fatigue, anxiety, depression, weight gain, neurological illness, especially multiple sclerosis, Parkinson's, ALS, headaches, POTS, which is the postural orthostatic tachycardia syndrome, vertigo, any autoimmune condition, okay, whether that's thyroid or lupus or one of the gastrointestinal disorders like Crohn's disease, please do look at mold and mycotoxins. Fibromyalgia or chronic pain, very, very common with mold and mycotoxins. So please investigate that if you're dealing with that. If you have chronic Epstein-Barr, Candida, parasites, Lyme, or co-infections, it could be that your immune system is chronically suppressed by mold and mycotoxins, and you should look at that as a potential problem. If you're dealing with multiple chemical sensitivities, MCAS or mast cell activation syndrome, histamine issues, and especially small intestinal fungal overgrowth or bacterial overgrowth, rather. In other words, the bloating, the chronic bloating. If you're having chronic bloating, please look at mold as a potential issue. And then inexplicable skin rashes and psoriasis. Just to kind of go through and just a quick, because I'm a visual person, I know you are too. Sometimes it just helps to look at an picture like this. So hair loss, okay, chronic sinusitis or severe allergies. By the way, on the chronic sinusitis part, it is not typically against or bacterial. In other words, many of us think that, oh, I have chronic sinus issues, it's a bacterial problem. There was a study done by an ear, nose, and throat specialist who found actually that a lot of the chronic sinusitis is fungal in nature and only responds to antifungals. In other words, mold and mycotoxins can definitely colonize the sinuses, and we'll get into that a little bit today, and lead to systemic effects, essentially. Okay, so again, chronic sinus issues, think fungal, not bacterial. Okay, cardiac arrhythmias, we do see that due to the mold and mycotoxins, dysregulation of the autonomic nervous system, myalgias, muscle pains, decreased libido due to its effect on testosterone, skin conditions, like we said, painful lymph nodes, shortness of breath, abdominal pain, numbness and tingling, uncomfortable or frequent urination is very, very common due to the mold and mycotoxin effect on the antidiuretic hormone in the body. And then mold definitely affects the nerves. We'll get into that. I would say the most primary issue with mold and mycotoxins that we see is neurological in nature. In other words, everything from loss of equilibrium to mood swings to personality changes, headaches, brain fog, fatigue, feeling spaced out, memory loss. All of this is due to the effect of mold and mycotoxins on the brain. So what exactly are mold and mycotoxins? Well, we'll get into that, but first let's explain biotoxins, right? So biotoxins are a group of substances, and that includes everything from bacteria, fungi in our environment, okay? And they can create a wide range of effects, like we just said. They are neurotoxins, okay? Some of them are, cytotoxic, in other words, causing cell death, all right? Within the biotoxin category, it is the mold and mycotoxins, which are the most prevalent, which we'll focus on today. However, they can be created by ticks such as we see in Lyme disease, Borrelia burgdorferi, and then as part of this whole toxic milieu is the volatile organic compounds that makes our brains feel heavy, tired, almost like a drunk feeling due to the effect of the mycotoxins in the body. There is a type of bacteria now that we are looking at called actinomyces. We'll talk about that further. And then I must mention Pfiesteria, which is found in more brackish waters. This is how the whole biotoxin thing was discovered years ago by Dr. Ricky Shoemaker. Of course, we don't see that problem too much here in the Atlanta area, but it is something to consider. So again, mold and mycotoxins are a subcategory of biotoxins, okay? So we have this sort of broad category of biotoxin illness that include Lyme, parasites, and many other bacteria such as actinomyces. But the one we're going to focus on today within that biotoxin category is mold and mycotoxins. There's over 400,000 species. I mean, tons and tons of species of mold, because these things are breaking down, plant matter in the forest and many, many things. Our bodies are part of our microbiome. There's a good form of yeast and mold there. But there's only 25 species that, 25, they're really causing problems in humans, okay? And part of these are in the categories that you may have heard of, right? So Aspergillus, Fusarium, Penicillin, Stachybotrys, which is the black mold, Alternarium, Claptosporidium. And often what can happen is one mold can produce a series of mycotoxins. So I'll explain kind of the difference between a mold and mycotoxin here in a minute. But molds are often present in water damaged buildings, and they're always producing mycotoxins. So basically, the mold is producing these tiny little spores. And it's not so much that the spores are so dangerous, it's the mycotoxins they produce. So mycotoxins are so toxic that some of the US military has looked at them for biological warfare. In fact, one of the mycotoxins called mycophenolic acid is used in the hospitals. We use it in medicine called CellCept to suppress the immune system when we're trying to give organ transplants. So when I used to work in liver transplant at Emory University Hospital, we would give CellCept to help the person accept the new livers and other organs that were transplanted. So again, think about living in a moldy house. You're getting a certain level of mycophenolic acid that could be really suppressing your immune system, and all of a sudden all this inflammation and havoc can ensue. So anyway, molds can really multiply quickly in a water damaged home in as little as 24 hours. So obviously, if you ever have any water damage in your house, you must clean that up as soon as possible and get the humidity down below 40–50%. Otherwise, the molds can grow and cause quite a bit of havoc in your home. And then all of this depends on temperature and humidity. Like I said, in general, you want to keep the humidity below 50% and the temperature on the low side, especially in the summer months. Okay. One expression I like from Dr. Campbell is if mold is like the gun, mycotoxins are like the bullets. Another expression from Dr. Ann Corson, who's another great medical doctor, said that mycotoxins are like throwing sparks on a silk scarf. So think about the amount of havoc that that's creating in the body, unfortunately. Okay. Again, mycotoxins are something that you inhale. A lot of people, there are low-grade mycotoxin levels in foods, okay, but not enough to cause harm in humans, right? I mean, some of you are avoiding coffees with mycotoxins and things like that. That's certainly understandable if you're very sensitive. But most of the problems that we're going to see here today are coming from the home environment where the molds are producing mycotoxins and you're breathing those in, and that's causing lots of damage. Just how small are mycotoxins? Very, very small, down to 0.1 microns, okay, which is about the size of the virus. So think about the recent pandemic that we had and how difficult it was to control the small particles from that virus. Similar with mycotoxins, they're getting down to that level, and it might be worth mentioning here that it's very hard to filter off mycotoxins. In other words, the standard HEPA filter is probably not going to do the trick. You need to get a very advanced filtration process, which we'll talk about in future webinars, okay, as well as remediation. Often remediators are not filtering down to this 0.1 micron, and it's causing quite a bit of problems, okay. One thing that I thought I'd throw in today that is a part of the biotoxin category that's not necessarily a mycotoxin or mold, but it's actually a bacterium that is present in the soils and in our microbiome. However, we're seeing this more and more in the chronic illness population. So the reason I bring this up is some of you have really tried hard testing for mycotoxins and treating them, but are still sick. One reason could be actinomyces, which we shorten that to say actinos. These produce endotoxins in the body that may be more toxic than mold and mycotoxins. So again, not to overwhelm you here, but please do look at this Better Health Guys, Scott Ferguson's talk on actinomyces with Larry Schwartz, okay? And Larry did a study where he found that 2,000 patients who did this test called the Gini test which is a very, very advanced test that we'll kind of mention here in a little bit. About 42% of them were, the immune system were being triggered by actinomyces, not necessarily mold. So that's pretty significant. If you're a patient of mine or you're a new patient and would like to know about actinomyces, I'll share with you this white paper by Larry Schwartz. Very, very fascinating. Okay, basically these little bacteria could be coming in to your home. Your home is a negative pressure structure, and that's actually drawing air in, and through the stack effect, these actinomyces, which are the bacteria, another subcategory of biotoxin, and circulating around, and given the certain temperature and other conditions in the bedroom environment, including on the pillows and sheets, actinomyces could be a huge issue for you. To measure that, Envirobiomics has a test. It's called the actino test, and these are some of the scores. You basically want a score of 9 or below. Very interesting. So what are some of the statistics on mold and mycotoxins? Well, about 85% of buildings have experienced some water damage in the past. So think about, if you have a basement or crawl space, I mean, if it's been there for any period of time, most likely there's been a situation where water damage. In fact, yours truly had a problem with that last year, which I'll go into on a future webinar. But I have a split level ranch that has a basement, and unfortunately we had a burst pipe, and that caused all kinds of issues for us. And that tends to happen with practitioners who are trying to help their patients, often afflicted by the very thing that you're trying to help people with. Anyhow, it's a huge percentage, okay? And this goes for the workplace as well as your car. If you are experiencing mold and mycotoxin illness, please do look at not just your home, but other places such as your work environment or your car. Why is it such a problem now? Well, we've had lots of climate change, I'm sure you're aware. There's been more floods, hurricanes. There's a recent cold snap here in Atlanta that led to a lot of burst pipes. Some of you may remember that. The construction these days is airtight, okay, and therefore there's less ventilation. That's a problem. There's more and more fixtures. We have wet bars now. We have plumbing running to the refrigerators, and all of that can potentially leak. So any plumbing fixture has to be routinely checked, including drains, okay? Which was our case. We had a cast iron pipe that rotted out in the kitchen, and in that case, it was a drain, not a supply line. Cast iron, if you have an old home, can definitely rot out and cause leaks. Okay, so do look at that. We're spending more and more time indoors, of course. Climate control. Molds love the heating and air system. In fact, molds can definitely grow in the coil system and on the dust inside the ductwork of your home. So please do evaluate your HVAC system, and we can give you some tips on that in future webinars. There is a stack effect, okay? So this is when the hot air rises from the lower part of the home and is drawn in through the crawl space or basement, and then rises, and that just circulates the molds around the house. So for example, one common misconception is that I have just mold in my bathroom and therefore the rest of my house is okay. Well, that's not true at all, because like we said earlier, the molds are constantly producing mycotoxins, where these tiny, almost invisible toxins, and those circulate throughout the home through the stack effect and other and through the ventilation system. Okay, so it's a problem in your whole house, not just in one room. Okay. And then Wi-Fi and cell phones are everywhere now. Cell towers are everywhere. And Dr. Klinghardt did a little study where he showed that the molds can really grow exponentially, up to 600 times faster in the presence of the Wi-Fi environment. And so we think that's due to the mold and mycotoxins being stressed by the Wi-Fi environment. So if you're extremely sensitive, you're very sick, we always tell you to turn the router off at night and then come up with a Wi-Fi mitigation strategy, okay? And we can talk to you further about that. So why is all the brain fog and fatigue? What's the pathophysiology going on here? So if you guys have been suffering from this or dealing with mold and mycotoxins or think that you might have a problem, just consider that molds and mycotoxins are throwing a wrench in the entire biochemistry, and it starts at the most fundamental level where energy is produced inside the mitochondria. And that's the mitochondria, as you remember back to biology class, are producing ATP or adrenal triphosphate. And there's a very important first step here, pyruvate to acetyl-CoA. Well, this mold of mycotoxins throws a wrench in that whole process, so that this whole cycle of ATP generation is not happening. So we have to address the mitochondria and the cell membranes when we're dealing with mold and mycotoxins. Just to very quickly mention some of the issues with the brain and mycotoxins. So this was a great editorial article written by Dr. Campbell and his editor, and basically talking about how mold and mycotoxins are a demyelinating illness. So myelin, if you remember back to biology class, is kind of like a nice fatty coating on the nerve, okay? And you can see here this nerve on the right has been scarred by mold and mycotoxins. So again, we have to repair this damage, and we do that with very specialized lipid technology that we have here, okay? And then we have some unfortunate cases in our practice of Parkinson's disease, okay? And we've actually found Parkinson's as a problem with Parkinson's. Mold and mycotoxins has been a problem with Parkinsonism, okay? So, and even if it's not full-blown Parkinson's, we've seen tremors and all kinds of other neurological illness. Mold and mycotoxins, I just wanted to bring up a point that they're extremely hormone disrupting, okay? So we're talking thyroid, adrenal health, estrogen, progesterone, testosterone, all those hormones that, you know, we would like to optimize. Mold really throws a wrench in that. In particular, we've seen low testosterone often with mold and mycotoxins, and there's a special way of treating that. But just do be aware that if you're suffering from low testosterone and needing replacement, please do look at the potential of mold and mycotoxins as a contributor. One major hidden problem with irritable bowel syndrome is how mold and mycotoxins throws a wrench in the enteric nervous system. Enteric means, you know, your GI system, okay? And if mold and mycotoxins are present, you can easily get irritable bowel syndrome, small intestinal bacterial overgrowth, and in particular, small intestinal fungal overgrowth, which is very hard. It's not even a test for it. But we do see that these types of patients respond to very well to mold and mycotoxin treatment, not necessarily treatment for SIBO. And we have to differentiate between SIBO and SIFO. Okay, so we can discuss that on future webinars. So one test that Dr. Shoemaker has come up with to evaluate for mold and mycotoxins is a visual contrast test. Okay, and it's basically a test to differentiate, to see if your brain, especially the optical nerves, are being affected by mold and mycotoxins, okay? And it's a visual contrast test. You can do it at home. It's practically free. And it gives us, I would say, an indirect measurement, but it's highly specific, up to 95%. There's an 8% false negative with this test. And by the way, if you do have mold and mycotoxin stress, we recommend doing this at least monthly, especially if you're receiving treatment, to see how that's improving. Part of this test, by the way, which is done at vcstest.com, I'd highly suggest you do that. And if you do that test, and please do send that to us, we'll take a look at it for you. It also gives you a CIRS test. So again, CIRS is chronic inflammatory response syndrome. And if you are positive for 8 of the 13 of these clusters here, these symptom clusters, then that again is very highly suggested that you're dealing with chronic inflammatory response syndrome. Most likely, again, here in the South, mold and mycotoxin illness, but we also need to rule out other things like Lyme disease and viral illness and parasites, okay? So further suspicion that you could have a mold problem, well, let's say you failed the visual contrast test, okay? That's a red flag right there. If you're positive for the mold questionnaire that we send to you, then that's a problem. If you are positive for at least 8 of these 13 clusters, okay, then that's an issue. If you have all these unexplained symptoms that your doctors have not been able to figure out. And by the way, just a quick mention on that, if you go to your regular doctor on multiple mycotoxins and mention that to them, you may get a funny look because there's not really good testing for it. They can potentially run things like aspergillus or candida, but it's not going to give you the mycotoxins, which we'll talk to you about. So you need a direct test to figure that out. In other words, they're going to tell you about past exposure, not current exposure. So again, unexplained frequent urination, static shocks, we think that's due to the mold and mycotoxin effect on the antidiuretic system in the brain. If you feel better leaving your home or office and going somewhere else, and then your symptoms return on re-exposure, then that's another clear sign. However, some are so sick and can't detox very well that you're going to experience perpetual symptoms. You feel better after doing some sort of detox modality, right? So that's another clear indication or an indirect indication. And then doing very small treatments if you feel better. And then, of course, after cleaning and doing dehumidification and air filtration, okay? One important thing that I'd like to mention to you is that some of you who may think you have chronic Lyme disease may actually be mold and mycotoxin illness. So I'd like to point you to this article here with Scott Ferguson and Dr. Nathan and Dr. Anderson. Great article to get into that discussion, okay? We have our ways of detecting this, but in fact, I will say that often with mold and mycotoxin illness, we see many other things. Lyme, of course, parasites, viral illness, and other things. That's just because mold and mycotoxins have a tendency to really lower that immune system, okay? So not good. Now, that being said, on a testing perspective, there is some cross-reactivity that we see with mold and mycotoxins. In other words, you can have false positives on Lyme, CMV, and the Epstein-Barr test. It doesn't necessarily mean that you have these things. It means that mold and mycotoxins may be your priority issue, and therefore correct testing is imperative. Again, just real quick, for you guys who've been suffering for a long time and have not read Dr. Neil Nathan's book, please do read that, and it'll summarize a lot of the things that I've been saying here today. It's on Amazon, okay? So testing the internal environment, okay, we mentioned the visual contrast test, okay, but that's, you know, a computerized indirect test. For a long time, we've been using urine mycotoxin testing. In a lot of cases, this is appropriate, especially if we can't get a blood draw. These kits can be sent to you in the mail. However, we've had some issues with this. In other words, we've seen high levels in folks who are asymptomatic. That's a little confounding. In other words, no symptoms, but high levels. We've seen situations where they're highly symptomatic, but nothing much coming back on the test. So that means that, you know, it could be that the body's not detoxing very well. And nothing against these tests, but we feel that these are not as direct as we'd like. There's some guesswork here that has to take place, and they're expensive tests. So we want to know for sure if the patient has mold or mycotoxin stress. CIRS panel, this is the chronic inflammatory response panel. These are highly advanced research level testing that Dr. Shoemaker has come up with, and we can use your existing lab or insurance and run it through LabCorp or Quest to give you some answers, okay? But again, these are indirect, okay? So I would consider them as urine testing to be indirect, as well as the CIRS labs. I know that's debatable. I hope I'm not offending anyone, but that's how, you know, that's my deduction. The MyCoLab test is more of a direct test. Okay, so again, we have these indirect things, these research level things. The urine mycotoxin test, rather expensive, but for the slightly more, I mean, like $25 more, you can get a direct test that tells you if you actually have the harmful mycotoxins in your system, not the molds, not the species level, but the actual mycotoxins that have been known to cause disease in humans. and that is a antibody test, a serum antibody test. It is a blood test. That's a little inconvenient, but in our thought process over the past few years, it's more of a direct and test to clarify what's going on with the system. Okay. Neuroquant is a special MRI test. We'll show you some examples of that here. Genie test, I'll just quickly mention, very advanced transcriptomics test, rather expensive. Okay, it can tell you whether or not have CIRS or not, and sort of what are the priority causes of that. But again, it's a little bit too expensive for many folks to engage in. The IGL test out of Germany is very highly specific. It looks at the molds and mycotoxins on the lymphocyte level. Very advanced test, but also quite expensive. We have that capability if you're interested. And then some of the advanced biofeedback techniques we find is the most simple and cost-effective way to determine if someone has that. But again, this is also considered an indirect test. Okay. And that goes for field control therapy as well, which we use for various situations. Okay. But anyway, that's just a general overview of how to assess the internal environment. Okay. What does the MyMycoLab test look like? Well, it looks at both IgG and IgE antibodies. Now, I'm going to stop right there because if you're a medical person listening to this or you're a savvy patient, you'll know that IgG, wait a minute, isn't that past exposure? That's true for things that have a bacterial cell wall. Okay, so, if you say Lyme, IgG, well, that could be a past exposure, most likely a past exposure, not a current exposure. We need IgMs for that, right? With mycotoxins and things that lack a cell wall, the toxin is representative of your current body burden. What am I mean by current? I would say in the past 2 to maybe 10 weeks in that time frame. So if you have a positive hit like this person does here for vomitoxin, that means it is currently in your body, in your system. Okay. So very important to differentiate. Now, many of you who suffer from mold and mycotoxins are also dealing with IgE reactions. So we'll get into that here in a second. One common thing that we see, and you can see this hit here on this test, is the vomitoxin. Okay, that's actually coming from Fusarium, which is a really common indoor mold. Okay, and then the question I get, well, is that coming from food or my environment? No, it is not coming from food. You would have to eat to have these types of levels that we were seeing, up to 20 slices of really moldy bread. I mean, I'm talking chock full, covered, smelly, moldy, blue mold. Okay, which would be disgusting, right? And then you may see it in your test, right? But no, this stuff is coming from inhaled mycotoxins in your home, and it's giving you a body burden of mycotoxin illness, and so not good, right? So this test also looks at the IgE, which is the histamine and mast cell stuff. So one common problem that we see with mold and mycotoxin illness is all of the problems with histamine and mast cell issues, food allergies, multiple chemical sensitivity. Well, here's why. Now, this person has some low level stuff here, but often we see this to be quite high. And here's the cool part, guys, is that these IgG antibodies, and if you're symptomatic and you're positive on this test, with treatment, the IgG and the IgE antibodies resolve over time with treatment. Okay, usually 3 to 6 months. All right, and we can always repeat this test and see that it's lowered. Okay, and we have evidence of that with many patients. Okay. By the way, mast cell stabilization is key if you have hits here. Okay, so very important. Okay, and we can help you with that. That's another whole discussion. Okay, another whole discussion about how to stabilize mast cells. It's a very complex topic. So yeah, so just to reemphasize real quickly here, that the urine mycotoxins will not give you the IgE, IgG antibodies, nor will it tell you the levels of these. It'll only tell you if the mycotoxins are present in the urine. Like we said, they're sometimes there, sometimes not. Therefore, we would recommend the MyMycotox test. Okay. And that is the smoking gun, in our opinion. If you have that, then, despite everything else, you've got mold in your system. I cannot do this without mentioning the CIRS here, the chronic inflammatory response syndrome. Very complex topic. This is a very busy slide. There's no, I don't expect you guys to memorize this or understand this, but just maybe quickly here, let me just show you that a long time we thought that the adrenal problems and the chronic fatigue was all due to adrenal issues and thyroid issues. No, it's much higher up than that. It has to do with melanocyte stimulating hormone, melanocyte stimulating hormone, MSH, produced from the hypothalamus. Okay, and we can see the wide-ranging effects. This is why, the World Health Organization said it's a great masquerader, right? Because it's causing sleep issues, insomnia. How many of you have unexplainable insomnia and don't know why, right? Chronic pain, fibromyalgia. They say that there's no cure for fibromyalgia. Yes, there is. If you treat the mold and mycotoxins and you don't have this chronic stress on your nervous system, then the fibro can get better. Okay. The GI problem, same thing. If you've taken Xifaxan for your IBS and still not better, and you have not looked at your external environment or your internal environment for mold and mycotoxins, please do so, right? Lowered MSH can cause chronic prolonged illness. It's just things that you just can't get better. Getting chronic, upper respiratory tract infections and things like that. There is a staph bacteria that's resistant called Marcons, which can grow in the nose. And even if you don't have symptoms of sinus problems, Marcons can be there. We can test you for that in the office. And then the effect on the ADH system, which is the urinary system, we can explain that. We do see urinary issues with that, reduced sex hormones like we talked about, and this chronic dysregulation of the ACTH levels, which affect the adrenal system and lead to chronic fatigue. So again, everything is kind of driven by this lowered MSH, right? So to work this up, we can actually look at these parameters, and this was very succinctly outlined by Dr. Ricky Shoemaker in his protocol. By the way, if you're a practitioner looking at this, do check out his training, okay, on his website, survivingmold.com, okay. The HLA-Dr is not the 23andMe genetics, but it'll tell you more specifically if you have the genetics for mold, which I'll show you here on the next slide. Transforming growth factor beta 1. So when we measure the CIRS panel, and by the way, again, we can run this through your insurance, through some of the major laboratories like LabCorp Quest. We see this increased, and this is an overactive immune state, and then it stimulates like Th17 and all this chronic inflammation. So we see these levels very, very high. Typically, we start seeing symptoms over 5,000, but we've seen as high as 20,000 and above. So it's just highly, highly inflamed, similar to what COVID could do or did do back in the pandemic and lead to the cytokine storm. So we can measure that, okay? The melanocyte stimulating hormone, which I just mentioned, it's this master regulatory hormone. And if it's low, it can lead to leaky gut syndrome. And we see this in about 90% of biotoxin illness. Again, not necessarily mold. Lyme can cause this too, okay? So you must differentiate. MMP9 or matrix metalloproteinase. That's another measure of hidden cytokine production, okay? Cytokines are the chemical messengers in the body, and when those run wild, you're in a constant state of inflammation, fight or flight. We start to see this over 450, and we start to see that also the mast cells in the low histamine. So therefore, a low histamine diet and a low amylose diet that Dr. Shoemaker talks about is very helpful. Also, high-dose fish oil is helpful. We can actually remeasure this, like say you don't know if you're getting mold exposed in the home, and you go say to a relative's house for a period of time. We can remeasure the MMP9. If it's lower, that means you're being triggered, your immune system is being triggered by your environment, okay? Marcons, which we mentioned before briefly, we can do a nasal swab for this and tell you if you have this. And it is treatable with various antibacterials and sometimes antifungals, okay? Mold and mycotoxins causes leptin resistance, unfortunately, and this can lead to weight gain. So those of you who have residual weight gain and can't lose weight no matter what you do, it could be mold related. So we need to evaluate you for that. A little bit of complex discussion, maybe too much for this crowd, but it does really throw off. So if you're having unexplainable frequent urination and static shock sensations, that could definitely be mold and mycotoxin illness, okay? On the HLA-Dr workup, okay, I know it's a little confusing, but just if you wouldn't mind, just keep in mind that about 25% of the population has this inability to clear mycotoxins. In other words, their immune system is not set up to clear mycotoxins, and it puts you in a chronic state of innate immune activation, okay? Chronic inflammation, okay? And so we can run this through your insurance, right? Again, very different than 23andMe and many of the other genetic tests out there. Here's an example of what it looks like. So, and this is what you do not want, by the way, is genetics for multisusceptible chronic fatigue or multisusceptible. But I will say this is very important. If you have a family, right, and you've been chronically ill and no one's been able to sort that out for you, and you work with us and we say, hey, listen, you have these genetics and this is why you're sick, but maybe your husband is not or your loved ones is not, then that's why, okay, you just have the unfortunate situation where your genetics cannot clear it out. And sometimes that helps others on your care team understand what's going on with your situation, okay? So very important to assess for this. There's other more advanced things. Again, very briefly, we can look at something called complement protein, C3A and C4A. We can kind of differentiate mold versus Lyme there. It's a little bit tricky, okay? So I put some notes down there for you to review. VEGF is another indirect measurement of cytokine production, okay? Just chronic inflammation. And it involves a low oxygen perfusion state. So again, this is why we have so much fatigue and pain, because nerves and the mitochondria need oxygen to function. If you don't have that, then you have a problem. Cardiolipin antibodies, if these are positive, you could very much have an autoimmune attack. The mold and mycotoxins have left, or biotoxins have created a autoimmune situation in your body where it's actually attacking the mitochondrial membrane. Not good. I've seen that in a few cases, and that does increase your risk for clotting, by the way. We talked about the adrenal dysfunction, and then last but not least is vasoactive intestinal peptide. And if that's low, there's chronic inflammation, shortness of breath, and chemical sensitivities. However, I'm not too sure about the accuracy of this test. We've seen that it's low in some folks who are rather asymptomatic. So, keep that in mind. We have to put all these pieces of the puzzle together. Some more advanced parameters here. I'll let you review this, but just know that mold and mycotoxins can really throw off the coagulation system, and a lot of times make you hypercoagulable and risk for MI and DVT. It also worth mentioning, there is a echocardiogram we could look at increased pulmonary artery pressures, which we do see with mold and mycotoxin illness, and that can create a shortness of breath. Okay, so we can order that for you if you're interested. Just to introduce you guys to a very advanced test that we work with called IGL Labs out of Germany. This is their intracellular electrical capacity score inside the lymphocyte, which is a white blood cell. But you can see here, this person has quite a high level of citrulline, and that's a mycotoxin. Fusarium, as we mentioned, is a mycotoxin. Mycophenolic acid, okay? This person has quite a bit of mold and mycotoxins affecting their cellular system, okay? So that's an advanced test, okay? Another advanced test is the NeuroQuant MRI. And this test is a special software that we can order for you, or a special analysis using a special software, I guess we should say. If you have a certain NeuroQuant score, that can be positive for mold, and we can also differentiate Alzheimer's. Now, there's whole webinar series. If you're a practitioner, and interested in this, it's a rather tricky thing to get into, but it can be helpful to differentiate different disease states in the brain. Okay. One test that we use here on a routine basis is called Autonomic Response Technique, or ART, okay? And this is Dr. Klinghart's biofeedback technique, which we use here. It's an indirect test, okay? However, it's part of our physical exam, actually, okay? It can give us very quick, deep answers. In other words, do you have mold? Do you have Lyme? Do you have Epstein-Barr? And if so, what are the things that we need to do to get the body to start to regulate again, or get the autonomic nervous system, which is the supercomputer in the body, to function better, right? Okay. Again, not accepted by mainstream medical, but we've had to go there just because of the expense of some of these tests, and it's in our experience been found to be highly accurate. Okay. So we've talked about the internal environment, all the different things that we can do to assess the internal environment. Well, let's say we have a positive visual contrast test, we have a positive MyMycoLab, we're seeing it with our advanced biofeedback. We've skipped some of the more fancy tests like IGL and maybe even a CIRS test, right? Due to financial reasons or whatever. Again, we're all just trying to put together a piece of a puzzle here. Now it's time to look at the external environment, right? So you may have heard of mold plate testing. Okay, you can definitely get mold plates. We can give you a resource for that, but that's a little bit nebulous because there's just ubiquitous molds in the environment. However, if you fill up a plate like this, that's could be a problem. It could definitely be a situation that you need to look into. The other one is the ERMI test, which we'll talk about, hurts me too. The EMA test, actinomyces, which we referred to earlier, spore trap testing. By the way, I will mention very briefly that spore trap testing is a very common test that mold remediators do when they come out to the house, or mold inspectors rather. And they get a sort of a static test of the air, and they compare that to the outside. And in our experience, often that's unremarkable or negative, yet the patient is highly symptomatic, and we're seeing positives on the internal environment testing. And we're thinking that something may be off. Yet when we sent someone who's really experienced, an indoor environmental professional, and they run a series of tests, and we see positive on that. So in other words, negative on the spore trap testing, and but positive on these other things. And that makes us question the validity or the reproducibility of the spore trap test. Now, I'm not trying to offend anyone here. If you're a mold assessor looking at these things, I get it. This is what you do. However, I'm just telling you our experience with our patients, right? And so an advanced IEP or indoor environmental professional would look at all kinds of testing in addition to spore trap. They would also look at the ERMI. They would look at the EMA test, which we'll go over. But you can actually tape test. If you see a tiny little, this inspector sees a tiny little bit of mold there, they can do a tape test. I mean, that's the most direct way to do it. And they can look inside the walls. We've had situations where patients had multiple mold inspectors come out and found nothing much remarkable. However, when they looked inside the walls using infrared imaging and the hygrometer testing, which is humidity testing, they find the mold problem. So that's a huge, huge thing, okay? So just making you aware of that. And please do work with someone who's highly skilled, who knows all of this. I won't get into that now, but we can always give you some references if you reach out to us, okay? On the ERMI test, it kind of looks at a certain scoring system, okay? So we'll kind of get into that, but I just wanted to show you just kind of the statistical breakdowns in terms of quartiles. There's about 50% of houses that are under the 0 mark, which is what you want. And that's a relatively low mold index. However, anything between the 0 and 5 is considered medium to high. And then anything between 5 and 20 is a high. And then unfortunately, over 20 is very high. So some of you are walking around with some very high levels, unfortunately. And it's important to get an assessment and treatment. What does a report look like? Well, you're going to have all these molds and mycotoxins here in group 1, but the group 2 is the most common ones. Okay, so when you subtract group 2 from group 1, you get a sum of logs or a score. And in this case, again, it's very high. It's above 20. And this patient, by the way, has been chronically ill for some years and seen lots of doctors. And finally, we are starting to understand that his environment could be a problem. Just to kind of give you Dr. Shoemaker's viewpoint on this, we see chronic fatigue and illness, especially those that have the positive genetics for this, starting somewhere between 0 and 5. Okay, so everything from chronic fatigue, and then extremely dangerous for these people, patients, unfortunately, anywhere between an ERMI score of 10 and 20 and above. Really what we want, especially if you have these genetics, is to be on the 0 and below, okay? Pretty hard to do in our experience here in certain homes in Atlanta, especially the older homes, due to the various constructions, but we can work with you to determine that, okay? And just a further depiction on the ERMI quartiles here, okay? And then hurts me too, if you use the Biotoxins test, it'll also calculate a hurts me too for the same cost of the test, the ERMI test. And again, you don't want anything greater than 15, okay? And this person has a 28, so that's not good. The EMA test is a mycotoxin test. So again, we have the molds, and then we have the molds producing the mycotoxins. So the ERMI test tells us more about the DNA in the mold. Okay, so the ERMI test is run. You order a dust swab test and you swab the dust, and then you send that dust off for analysis through a testing methodology called polymerase chain reaction. This does a similar, but looks at the mycotoxins. So in this case, the person's mycotoxin levels were relatively low, despite having an elevated ERMI test. So it's a little bit tricky to differentiate that. So we've talked about, how to, if you have a chronic condition and you've been struggling, definitely look at mold and mycotoxin illness. You need to differentiate between that and other things like mold, Lyme and Epstein-Barr and Candida and other things that have been implicated in chronic illness. And there's a series of internal and external tests that we can run, okay? But once we've determined that you have this condition, and again, our red flags go very high with a positive serum test for molds and mycotoxins, okay? Then we get into treatment, and probably the first step in treatment is the avoidance, and that's the hardest step for most people to grasp because, for example, you may have family members who don't believe you or discount this problem, or other doctors. We see this all the time, unfortunately, and therefore we highly suggest you work with a practitioner, can help you navigate this very complex, sometimes political problem in your workplace or family, okay? But the number one rule of toxicology that Dr. Campbell reminds us is that we have to get the patient away from the toxin and the toxin away from the patient, okay? So the further you're in this environment, breathing these mycotoxins in, the sicker you will be despite treatment. So if you're not getting better or have not gotten better with treatment, well, it could be that you're still getting exposed. And again, if it's not in the home, it could be in the car or the workplace, okay? And in such case, you want to remove the cause, either remediate the home or the workplace, or get out of there. In some sad situations, we've had to have patients move and they actually get better when they move from their living environment. And then we needed to treat the cause, right? So there's a lot of treatments out there for mold and mycotoxins. We sort of dabble in all of those, but it's a little bit too much to get into that discussion on this webinar. Okay, we'll do that maybe on the next one. And then we got to repair the damage. Remember, the molds and mycotoxins can damage the mitochondria, poke holes in the mitochondria, cause leaky mitochondria, a cell danger response. The body is in chronically inflamed state. We have to help resolve that inflammation. We have to repair the cell membranes. We have a special technologies for that. We have to repair the endocrine system, right? And then ultimately, that's all the hormones. We have to give you enough power to overcome this, and then treat all of the hidden stealth infections. Again, we often see these little things running in the background. So we got to treat the mold and all of these things, and then the immune system can repair itself. And we can also give immune supports. We actually work with special peptide therapy here. And then we can see improvements, but it does not happen overnight, okay? In general, rule of thumb is about 6 months to treatment, but some take longer than that, okay? So I hope that gave you a good understanding of molds and mycotoxins and biotoxins. I know I went through it very quickly. Feel free to, go back and review this. If you have a patient, a family member, or, someone else that you think is suffering from this, please do share this video. And then we'll get in on future webinars about the treatment. As I mentioned, there's many treatment modalities. Dr. Shoemaker has one, Dr. Campbell has one, Dr. Jill Krista. Not everybody does well with any one particular treatment, has been our experience. It's sometimes a hodgepodge of things. And everyone has different sensitivity levels. Some can't swallow pills at all. So it gets a little bit tricky. And in some very extreme situations, we have more and more sensitive patients these days, homeopathy and things like low-dose immunotherapy, which is almost like a homeopathic treatment for mold, has been really great. So we have to do many things at once, okay? And anyhow, in the next after that, we'll get into some mold remediation. I'll probably interview a couple of mold remediators that we work with. So stay tuned on all that, okay? And thanks for your attention today. Really appreciate it. I know it's a complex topic, and maybe some of you guys have heard this before. I hope you learned something. If you have any questions, please do reach out to us. We're in Decatur, Georgia. I'm at Martin at treeoflighthealth.com, so always feel free to send me an email or give me a call. And thanks once again. I will say, listen, people get better from mold mycotoxins. So if you have this, you've been struggling, you definitely can get better. If you've headed down one of the pathways and are still not better, there could be definite reasons why. And we can help resolve that for you, okay? So best of luck, and we'll be in touch, okay? Take care, and thanks again.